Diabetes is a very common problem today. We have at least about 10 to 12% of our population having diabetes. We need to manage it effectively because diabetes leads to various complications. The most effective ways of managing diabetes is doing exercise every day, having a proper healthy diet and taking the medications prescribed. Exercise is very important. Doing exercise of about 30 to 45 minutes every day. Simple exercises like walking, swimming or running or whatever you are comfortable with has to be done. Even on an exercise cycle you can do at home or just walk every day for 30 to 45 minutes. This is what is important. So it has been shown in several studies that at least 150 minutes of exercise every week is important, or in other words we can say that every day you do about 30 minutes of exercise, which is very important and has several benefits. It reduces the requirement for medications, it improves the reduction, it causes weight reduction, it makes you feel better. So this is a very important aspect of diabetes management. The other important thing is that many people have several myths about diabetes. They don't take treatment unless they have symptoms. They feel that if they are not having any symptoms of diabetes, they feel that they should not be taking treatment. But it is during this period when they are not taking treatment and when they are having a undetected hyperglycemia, that is the blood sugar levels are high and they are not noticing it, that is the time when the complications are developing. The complications affect the eyes, the kidneys, they also lead to excess of heart attacks. So all these problems can be prevented by effectively managing diabetes. Another important myth that people have is that taking insulin is something which is going to cause harm, but it is not like that. Insulin is very good for people with diabetes, and taking insulin doesn't mean that they very often people feel that if they take insulin they have to continue taking insulin. It's not like that. Insulin is required at some situations when blood sugar is not controlled by other medications. Insulin is required, and insulin does not in any way increase the risk of any of these complications. One important aspect about diabetes management is to check regularly for the blood glucose levels, check the hemoglobin A1C levels, which gives an indication of the average glucose in the last 3 to 4 months. So 3 to 4 times in a year checking the HbA1c and checking glucose levels routinely, say every 10 days or every 15 days at the minimum. That is what is required, but you could do it even more frequently. You could do it every day also, and checking at home is important to know what is happening with the day-to-day activities and with the day-to-day diet that you're following, the type of exercise that you're doing. It is going to help you in deciding how you're going to manage your diabetes.